I keep telling her now that she's going to be 30, she has to start lying about her age so that.
This is the time you start doing that, right?
Exactly. Well, I said I'm not really lying about my age, but when I tell people I have a 30-year-old, they do the math. So,
wow.
Yeah.
Hey, Carrie, I'm seeing this stuff on the table.
Oh, you are? Okay. Let's move it. Yeah, we're good.
And otherwise, I am all set.
Okay. So, here we go. All right. Dr. Talani Ajabbe, thank you so much for being with us.
Thanks for having me.
It seems like alcoholism has kind of moved to the back burner with so much attention focused on opioid addiction.
Absolutely.
But drinking really affects far more people, doesn't it?
Yes, it does. According to the National Institute of Alcohol Abuse and Alcoholism, about 140 million Americans qualify what we would consider current users of alcohol, which means they've had alcohol intake within the past 30 days. That number includes 2/3 of U.S. adults. Mm-hmm. Out of that number, 25% of them are what we consider binge drinkers. Mm-hmm. About 5% have a condition called alcohol use disorder. Mm-hmm. The reason why this is important is that a lot of we've had decades of epidemiological studies that have shown that people who qualify for those two categories tend to have serious complications from alcohol abuse. Mm-hmm. So the number is on the rise. And what we've seen is a lot of attention is not being brought to this. These are people we consider at-risk drinkers or heavy drinkers. And on one side, because opioid has taken over, I mean, in our clinic here, what we've seen is around 2011, there's been an uptick in the number of opioid-related admissions to our clinic, while alcohol is going down.
But alcoholism affects many more people.
It does, but there's a tendency for us to normalize alcoholism. So if I don't have any serious issues in my life, right? I don't have any psychological problems. I don't have social issues. I don't have legal troubles like having multiple DUIs. I don't have problems with my academic performance, or I don't have problems at my job. I think I'm a functional alcoholic. I just drink, but I'm fine. Mm-hmm. But these people are still at significant risk of serious health complications as a result of the alcohol use. Mm-hmm. So it's a very worrisome development with people just moving away from alcohol, and we all focus so much on opioids at this time.
Right. There are a lot of tests that people can now, let me just go back. Okay. We hear a lot in the public about numbers when it comes to, are you an alcoholic? You know, do you have, as a woman, more than 2 drinks every day, or a man 3 or 4, or what the numbers are for binge drinking. Yeah. But the at-home tests that are available really focus on some of the psychological issues surrounding drinking.
Yes.
So I thought it might be interesting to go through a few of the questions on one of the most used tests that people can take at home.
Absolutely.
Can we do a couple of those?
Yes,
okay.
Please.
So I think we're going to show people at home the questions.
Okay.
Okay. This is from the National Council on Alcoholism and Drug Dependence.
Okay.
Do you try to avoid family or close friends when drinking? If that's a yes, why is that significant?
That's significant because a lot of people who are drinking, usually about the ages of about in the early 20s, when people were drinking, most drinking is for euphoria. It's just for the pleasurable feeling that they have from drinking. Over time, because of the euphoria, people tend to start drinking heavily, especially college students or people around that age. And over time, they develop tolerance to alcohol. So the heavy drinking even gets worse. So around the age of about 30, 35, they started seeing some real consequences of the drinking. Now, I'm growing, I'm becoming more of an adult with responsibilities, right? I have a home, I'm married, I have children, I have responsibilities, but I have this alcohol situation that I'm also dealing with. So now they're not able to meet their obligations to the spouse, the children, to their jobs, and things are falling apart. That comes because of the pressure they feel from the responsibilities they have. It comes, then they start a little bit of shame and guilt start seeping in. You know, when you're not able to help with financial situations at home, meet the emotional needs of your spouse, you're not there for your children, you're missing days of activities in school, now you're getting suspended from work, sometimes you're in between, you're changing jobs because you're getting fired. Now there's a lot of shame and guilt that comes in. So somebody who used to drink as part of a group, hanging out with friends, they start to hide their drinking. They start getting more defensive about their drinking. So they isolate. They become what we call isolative drinkers at that point. So, and that doesn't get better. It keeps getting worse. So this is sort of a defensive mechanism to deal with the psychosocial issues that are now coming up.
All right, here's the next question. Do you sometimes feel, wait, let me just do the other one because I think here's the, okay. Here's the next one. Do you drink heavily when you are disappointed, under pressure, or have had a quarrel with someone?
So the way you can explain that is, I always tell people, for any drug, including alcohol, the reasons why people start drinking are not necessarily what keeps them drinking or using drugs. A lot of people learn early in life to use drugs or alcohol as a form of coping mechanism. So when they're going through a lot of stressful situations, the alcohol and certain drugs happen to be some of the quickest and most effective ways of isolating yourself from real life issues.
That's what we call self-medication.
Self-medication, yes. So people use alcohol for that because it kind of disconnects them from the issues, the real issues of their lives, including the people around them. So alcohol and other drugs tend to isolate, like it puts you in a bubble. So you're depressed, alcohol will help you with that. If you're having anxiety, alcohol will help with that. If you're having difficulties sleeping, alcohol will help with that. It seems like a very good solution to the problem because for some reason, they haven't mastered adequate coping skills to handle real life issues in some cases, and that's why they resort to alcohol. But that's a very good sign of somebody who's heading, if this is a major way that they deal with stress in their lives, that's one of the red flags that we actually notice very quickly.
All right, here's another one, another question. Has a family member or close friend expressed concern or complained about your drinking? People are starting to notice here.
Yes, yes. So the issue there is that, like I said before, there's a lot of people who are at-risk drinkers, right? And what that means is I don't think there's a problem with my drinking. I drink, but I'm still able to keep my job. I still have a home. I still have a family. I'm paying my bills and all that. But so a lot of people, the society kind of looks away if you're able to meet your major obligations, right? Whether it's in your house, at your job, at your school. But at some point, so people start noticing some changes. Now you're getting to the territory where now you're beginning to have problems. So you're getting into trouble at work. You're so absent-minded at home. There's some bills are not being paid. And yet, the only thing that's very consistent in your life is your drinking. You don't move away from that. And somebody might come to you, and sometimes it could be something as simple as your personal care, the personal hygiene. Like, what's going on here? Do you have an alcohol problem?
Yeah.
That makes you very angry because you don't, because of stigma.
Right, sure.
And sometimes also, even though there's an alcohol issue here, families also have to be very careful the way we navigate this problem. You know, if we try to be too aggressive about it, we further isolate this person. So a more gentle, more supportive approach will be what is recommended to help somebody to acknowledge they actually have this issue. They know they do have the problem. They just hope that you don't know. So the first time you bring it to them, the primary thing for them to do is to fight back. No, I don't. So I didn't want the label as well.
Right. So to avoid that, your approach is really important to somebody.
Absolutely.
Okay. We'll do one more that I think is kind of, let's see. Eating. Maybe the issue of have any of your blood relatives had a problem? Is that, do you think that's important because of the gene or not so
Yes,
much?
that's very important.
Okay. All right, so we'll do that one. Okay?
Yeah.
All right. I'll ask you the question.
Okay.
Another question in the quiz is, have any of your blood relatives ever had a problem with alcohol? That's a really significant one.
Very, very. So what studies have shown, we've had twin studies, we've had adoption studies, family studies. A lot of those studies have shown over the decades is that there's a strong genetic component of the risk of developing alcoholism. Mm-hmm. As a matter of fact, that risk is about 50 to 60%.
So, yeah.
So what that means is the day you were born, by virtue of who you are and where you come from, you're already at a 50% risk of developing alcoholism if you drink.
Mm-hmm. So let's start that one again. I'd like to just, this genetic part, because
Yes.
there is a gene for alcoholism.
Yes.
Can you start by
Yes.
saying that we know there is a gene?
Yes, we know there's a gene. We know there are multiple genes that if you have them or you have like a variation of this gene, you have a risk of developing alcohol use disorder. Mm-hmm. So the risk of having that condition, it's about 50 to 60%. Once you have that gene, or you have a variation or aberration of a gene, you already have a 50 to 60% risk of developing alcohol use disorder. So the day you're born, you already have the risk in place. Mm-hmm. So all you need is the exposure to the drink. So you could be, I remember having a patient a few years ago who said she's never really been somebody that drinks alcohol. One day she went to the Destiny Mall with her brother's wife, and she had a margarita for the first time, and she liked it. Then she went back on her own. Within 1 year, when I saw this patient, she was in the ICU for complications of alcoholism.
Wow.
And she struggled with that for years until, she was in treatment with us and she did better. Mm-hmm. But that's how, if you have the genetic risk, the chances that you're gonna have these serious complications are much higher. So, which is also in a way unfair, especially for those who stigmatize this condition, because, I can drink a glass of wine at night and it's fine. You can drink a glass of wine and it's fine. But for people who have this genetic risk, when they drink, the drink causes something called alcohol-induced craving. It's like there's a cascade of events that now start taking place in their brain that they can't stop drinking. Mm-hmm. And you're going to see this across generations. You'll see some families where the grandmother, you could sit 3 women down, 3 generations, and they all suffer from the same condition.
Mm-hmm. So the drink puts the switch on, flips the switch. It turns on the switch,
yes.
Yeah. So this is Alcohol Awareness Month, which is why we're here.
Yes.
What do you want people to be thinking about as we focus on this in April?
Yes. First of all, I think the most important thing for me is that people should not forget about alcohol. Alcohol is a silent killer. Opioids, when people overdose on opioids and they die on the spot or within hours or within minutes, the acuteness of that situation catches our attention. But alcohol is more deadly because it affects a lot more people, and the consequences are so much. So a lot of people at this time have normalized what I call at-risk drinking or risky use behavior. They drink excessive amounts of alcohol. And I know you've talked about that, so I would say the numbers. For a woman, if you drink 4 or more standard drinks, so a standard drink will be
glass of wine.
A glass of 5 ounces of wine, which is about 12% alcohol, or you drink a 12-ounce can of beer, or you drink a 1.5 ounce of liquor, that's a standard drink. So if a woman drinks 4 or more of that every day, or drinks about 7 or more in a week, you're considered an at-risk drinker. If a man drinks 5 or more of his standard drinks in a day, or drinks 14 or more in a week, you're considered an at-risk drinker. If you fall in this category, a lot of epidemiology studies that have been done show that you're at considerable risk of developing an alcohol use disorder. And there's serious consequences for that. So let's talk, for instance, about liver cirrhosis. So a study that was done in the University of Michigan shows that over the past 7 years, there's been a 65% increase in the numbers of deaths related to liver cirrhosis.
65%?
65% from alcohol. That's about 10% increase, on the average 10% increase every year. So this is serious, and it's killing people. People develop liver complications, they develop pancreatic complications, the heart, the brain. There's so many ways to die. The most serious also is cancer as well. You know, there's a lot of linkage between even breast cancer in women and alcohol consumption. So these are serious issues that need to be addressed, and we shouldn't forget about it. It's a silent killer, but it's a very serious problem.
So I'm just going to kind of backtrack a little bit. People can take the quiz at home.
Yes.
Now I want to get back to the numbers we referenced.
Yeah.
What are the numbers for men and women that signal problem drinking? You don't have to answer it again because you already did. Okay, so then, so I think we've pretty much covered it, right? So I'm
Yes.
just going to thank you and we'll be done, okay?
Okay.
Dr. Ajabbe, thank you so much for being with us.
Thank you very much.
Alcoholism Awareness Month.
Thank you.
Some good information.
Thank you. All right.
Great.
Okay.
All right. Very good.
You didn't
Yeah.
talk about treatment. Did you?
Well,
Did you plan to do
how about
that?
if we do, let's ask about that.
Okay.
Let's ask about that.
All right.
So, ready?
Yep,
Okay.
still rolling.
So once you have come to the realization that you have a problem, you need treatment.
Yes.
What are the best ways to lick this problem?
So currently, there are 3 medications. So there's different types of treatment. Okay, so a lot of times we encourage patients to get into structured therapy that's geared towards alcoholism.
Like
So,
AA?
that 12-step
Right.
12-step meetings like AA. People can learn different skills during those therapy. It could be social skills. It could be relapse prevention skills, coping skills. They learn different skills. There's family-based treatment. There's what we call trauma-informed treatment, because a lot of people who consume alcohol is to mitigate symptoms of things like PTSD from trauma they've had in the past. So family-based treatment, family psychoeducation, patient psychoeducation. We try to address the social factors that are kind of enabling the alcoholism. So we do all that. But there's also medication management for alcoholism.
There are medicines.
There are medicines for it. So there are 3 major medications that have been approved for this. A medication called disulfiram. People may know it as Antabuse. It's been around for a long time. We call that that kind of treatment aversion treatment, which means if you have this you take this medication and you drink, you're going to get very sick. So that on its own prevents people from drinking. So, but what we've seen is that a lot of people who have alcohol use disorder, only about 10% of them are in treatment. 90% are not. Out of the 90% that are not in treatment, 42% of them actually believe that for them, recovery only means abstinence. Sometimes you don't need to be completely abstinent from alcohol. Sometimes the goal is to cut down on your drinking. Sometimes the goal is to set limits on your drinking. So there are other treatment that gets towards that. So we have a medication called naltrexone, for instance. Naltrexone is an opioid blocker.
Right, we see that in the news all the time.
Yes.
It's a life-saving drug for people having an opioid overdose.
Yes.
You use it for alcoholism too?
Yes, we do. So naltrexone also blocks the cravings from alcohol.
Right.
So remember what I thought when I talked about alcohol-induced drinking, like when you drink one, then you have to keep drinking and keep drinking. That is what naltrexone blocks. So people will say, I went to the bar, I sat down there, and I couldn't even finish a can of beer. I don't know what's going on. I just lost a taste for it. So they might not stop drinking completely, but they cut down significantly on the amount they're drinking. So that's what naltrexone is good for. They have, because of compliance issues, because sometimes, you can decide, I want to use the medication today, I don't want to use it tomorrow. We've now come to the point where they actually have the intramuscular shots. You only need to take it one day in a month. So they give you the shot, then you go about your life.
Right.
If you try to drink, you probably, after the first can of beer, you don't want to do more anymore. So that reduces heavy drinking. That's what it does. The third one is called acamprosate. Acamprosate is good for what we call post-abstinence drinking or post-deprivation drinking. So that if you've been abstinent from drinking for a while, if you resume drinking at a later time, you're less likely to have serious consequences, because now you're very sensitive to alcohol when you start drinking again.
I see.
So it reduces the chances you have serious consequences from that. And it also reverses the disrupted neurochemical processes in the brain. So it's a good medication like that. Those are the three that have been approved by the FDA. Because some people don't know that these treatments exist. So sometimes I will see patients on our inpatient service and they will say, I don't know what, I'm here because my wife thinks I should be here. I don't think I have a problem. Or they say the court said I have to be here. I don't think I have a problem. They don't even know their treatment for alcoholism. No, I can do this on my own. I just stopped drinking. Except that they're back after like a few weeks, they're back in the rehab again.
Right.
So
But you have medications you can give them?
They're medications that can take care of
You
this.
have therapies?
You have therapies.
And then there's AA, and there's lots of places to go to meetings.
So there's hope. That's the point I'm trying to make.
Yeah, that's terrific. Just finally, you mentioned, so not everybody who drinks too much needs to completely stop drinking.
No.
How do you decide who that person is, or how do they decide?
Well, they have to decide on that. So we have to, at the beginning of every treatment, we have to set a goal for treatment. Because if you set the bar too high, then they're not going to do anything.
Right.
So, I mean, we already know who is at risk. So if you can get yourself below the risk level, I think that's fine. And you do, and we also recommend that you make small changes over time. We want something that's going to be sustainable at the end of the day. So if I set the bar too high, like I told you, 42% of those who are not getting treatment say because they think treatment means abstinence, so they would rather not try anything. That's not good. So if we can set goals on cutting down on the drinking or treatment that can help them cut down to healthy amount of drinking, I think that's good enough.
Okay. So I'm just going to re-ask one other question.
Sure.
So what about treatment? What can you do for people who are drinking enough so that it's really interfering with their lives? Perfect. You already answered it. That's great. Okay, great.
Thank
I'm
you
going to
so
put it
much.
together like a
And
puzzle.
yeah.
Yeah. That was really good. You did.
Thank you.
Yeah.
Thank you very much.
I really appreciate it. It's so
meeting
nice
you,
to
Carrie.
meet you.
And this is important.
Yes.
Come back again.
Yeah.
We have a lot of things we would like to get out there through our program.
How many people do you?
I'll need your money too.
How many people who come through here every year are for alcohol? I mean, is it?
So what we're saying is 2004. Because that's the tracking we've done. In 2004, we had
Yeah, 2004.
about 600, almost 700 patients in 2004.
Right.
Last year we have 396 patients.